Hi everyone, welcome to my Instagram live. I am Dr. Judy, the plant-based MD. I'm gonna wait that a few more people join, and then I'm waiting for Qadira to join. Here you go. I'm letting her in my video now. I'm so excited you guys are here on this Monday, June 1st. It's a new month. And my birthday is the end of the month. I know that's not what you're here for, but I just thought I would share that with you. So I'm trying to let Qadira in. Oh, hold on, let's see. Okay. Technical difficulties. She's coming now. I had to click the button. But yes. So,
Hi.
hi.
How are you?
How are you? I am good.
Good
I'm
to
so
see
glad
you.
that you can join me
Thank
tonight.
you.
We got 37 people on here.
I know this is a hot topic.
I know.
It's definitely heartening to see the outpouring of interest and support for the talk that we are going to have tonight.
Yes, for sure, for sure. Definitely people are paying attention to race right now. It's like what everyone's talking about. And in the backdrop of the pandemic, I think it adds another dynamic, that I don't think would be the same if it was at another time. So if we get started, we'll both introduce ourselves and then we'll kind of get into it. I've just written some points. It's a casual conversation,
Excellent.
So if you guys want to comment, question, jump right in and we'll answer this too. So I am Dr. Judy. I am an internal medicine physician. I work as a hospitalist in Raleigh, North Carolina. And I am also certified in lifestyle medicine. So on the side, my side hustle, what I do is coach and help people to live healthier, be able to reduce their medications, and teach them how to eat healthier as well. And I'm known as the plant-based MD. I'm originally from Bermuda, and I've been in the US since 1999. And I think that's about it.
20 years.
Yeah.
So I am Dr. Qadira Huff. I am out of the DC area. I'm a board certified pediatrician, and then about 2 years ago started to get deeper into the world of lifestyle medicine. And it kind of came as the convergence of some personal kind of health and wellness journey that I was undertaking, as well as kind of professionally getting a little bit more interested in terms of the increase of chronic disease that I'm seeing in children, and thinking about some kind of root causes, and also thinking about upstream solutions in the world of lifestyle, specifically plant-based nutrition, more regular physical activity, all of these healthy habits that we know are at the heart of health and wellness. But in the world of primary care pediatrics, we rarely have enough time to delve in as deeply as we need to. And so that whole kind of combination of factors led to me starting my business called Sprouting Wellness, which is going to be a lifestyle medicine consultation practice, really to help families go from information to implementation along all these healthy lifestyle tenets.
Awesome. We're very similar. So you have your own business too, but yours is for kids and mine is for
Yes,
adults, teaching them lifestyle
exactly.
medicine.
Exactly,
Um,
covering the whole lifespan. That's what we
yes.
need. Mm-hmm.
And I'll tell you guys, we actually, Qadira, am I pronouncing your name correct?
Yeah, you got
Okay,
it.
I'm gonna mess it up. We met over Instagram. She was posting about walk with a dog, and we
Mm-hmm.
both do walk with a dog in our respective areas. Obviously, we haven't done it since COVID, but
I
that's
know,
kind
I
of how we
miss it.
connected. Yeah,
Yeah,
and I've been trying to find other, brown physicians, because a lot of times in the plant-based world, I feel like I'm the only one,
I
and
know.
so
I
it's just
know.
nice to meet someone else who looks like me, and
Exactly.
excited to have you on today. And funny thing is, I'll just tell you guys this too. Originally, when we planned this like a couple of weeks ago, it was to talk about pediatrics and pediatric topics, because a lot of you guys asked me about pediatrics, and I'm not a pediatrician, so I defer to the pediatricians for those questions about vegan diets and kids and what should they drink and all of that. So I was going to have Qadira on to talk about that, but then with everything going on this week,
Right.
we're like, no, we need to talk about this topic.
Definitely time
So
to shift gears.
yeah, and it's so interesting, like I feel like because of the state that America is in right now, it's divided already, you know, because of who we have in the White House. And then people are already in a state of trauma, so to speak, because of the pandemic. Like 40 million people, I think I read, are out of work. People are home. People have lost businesses. People have lost lives. So people are frustrated, angry, and upset already. And then on top of that, you have this racial incident with the policeman, George Floyd. It just is like,
it's
people
been a
just can't take it.
Right.
Yeah.
Right.
It
You
just
would definitely
tipped it over, because I don't remember there being such a response to other similar
not
situations
quite
before
like
COVID.
this. I think you've really hit it in terms of we as a society are just raw. And I think emotions have already been running high for a lot of folks. And so this was just the straw that broke the camel's back. And then for there to be like repeated horrible incidents related to racially motivated violence, you know, thinking about the father-son Ahmaud Arbery, and then this, and you know, Breonna. So there was just kind of back-to-back onslaught, and we were like, this is too much. And people are already hurting, like you said, from the pandemic. So I think that this has really kind of swung the pendulum towards there being this massive outcry across all racial backgrounds, which I can't remember in my lifetime as an adult where I've seen such a groundswell of support across the racial kind of alcoves, if you will. And so that is one positive I think is coming of this, where people are really ready to talk and face racism and discrimination head on in a way I haven't really seen recently, at least.
Yeah, me neither. That's been refreshing, because I don't usually talk about politics, race, or religion or anything like that on my platform. I've been shifting in the past recent months, but I posted something 5 days ago or 4 days ago that was pretty heartfelt and raw, and I didn't know what kind of response it would have with people. I really expected to have a lot of backlash, but so many people shared the post. Some people shared it to their page who are, you know, vegan influencers, and the overwhelming support from people that are not brown skinned was just really, really encouraging. So that was really wonderful to see. And in all of the different Facebook groups that I'm in, they're not Black groups by any means, you know, mostly Caucasian and other ethnicities. And all on the page and the feed, people are commenting about how terrible this is, you know, how they want to know what they can do. One person even asked, you know, what books can she give to her children to kind of teach them about race. And so people were, you know, Caucasian people were saying, you know, I've been blind to this and I haven't been paying attention to this, but, you know, I want to learn and I want to listen. So I definitely do think that being in the midst of a pandemic where we're open, we're raw, and maybe we have less distractions, you know, with everything being closed and shut down, that people actually open their eyes to it. Of course, you still have the people that want to say things like all lives matter and other things like that. But for the most part, I'm definitely pleased with the response from all races, and particularly the individuals that are not Black.
I agree. And I think that the other factor here was the graphic nature of the video and how just it was not open to interpretation. And I feel like the interpretation aspect is something that can play a role in like past incidents of, you know, police involved violence, is that, oh, well, maybe the person was doing X, Y, and Z, or, you know, had some sort of historical, you know, background that set them up for this to happen. But in this instance, like the video is so clear cut and just so grossly horrible that I think it's opened a lot of people's eyes to the fact that, wow, maybe I really need to like dig in and like think about how much racism is still a part of the United States, and the impact that it's having on Black folks in this country and across the world, quite frankly. So I'm excited. The other thing that I've been heartened by is like the various medical establishments like coming out with statements in support of Black lives and in support of the fact that
I've never seen that before either.
Never, ever. I'm like, wow, that's another way I knew. I'm like, this is different. There's something different here where we see this conversation moving more mainstream, especially in the generally conservative medical establishment. You know, like we don't typically delve into politics as a whole. And so to see like the, you know, the American cardiologist coming out with this statement with the the Association for Black Cardiologists. This was an amazing moment to say, we validate Black lives, Black health matters, we recognize health disparities are real, and we also recognize that racism and discrimination are directly playing a role in why we have health disparities. I'm like, wow, thank you for setting this up so that we can now move forward in terms of like how we can address it as a society and as individuals.
Yeah, absolutely. It's definitely a start, because if you deny that something exists, then you're not going to be part of the solution. So at least
Absolutely not.
now people are willing to talk about it. And also the information that came out with COVID-19 and the disparities in how
Exactly.
minorities have higher mortality rates. So
Mm-hmm,
that kind of
mm-hmm.
brought to light the healthcare disparities that we both know exist.
Very
So,
much.
and it's not something that's, hidden. It's very much visible when you pay attention to it.
Yeah.
I would say when I first moved to the US, I don't think I was as aware of
Mm-hmm,
what the experience is like in this country. And of course, racism is everywhere, and there's colorism in
mm-hmm.
most every country. Like in my country, the lighter skin you are, though everyone is considered Black mostly,
Right.
um, there's a preference towards lighter skinned brown people,
Mm-hmm,
so that
mm-hmm,
definitely exists everywhere. But there's different challenges that do exist in the United States of America that I don't think are present in other countries.
mm-hmm.
So as far as the healthcare disparities, let's talk about what factors contribute to that. Someone asked me that the other day when I was doing a video and whatnot.
Mm-hmm.
Do you have any
I
thoughts you want to
do.
share on what factors contribute to
Absolutely.
that?
So that's a great starting point. I think for me, coming from a public health background, I have a public health degree too. One of the first things we learn is about the social determinants of health. And essentially, that's the idea that humans don't live in a vacuum and that our health outcomes are a result of much more than our individual choices. So our health outcomes are as a result of the communities that we live in. So if your community has a lot of violence or poverty, you don't have a built environment that's set up for you to exercise outdoors, that's probably going to impact your ability to exercise and to get fresh air and to have that element of stress reduction that you give by living in a beautiful environment. The same thing can go for in terms of like food insecurity. And we've heard about food deserts and food swamps and how there's this differential access of quality food that's largely based on race and largely based on your socioeconomic status. And so that impacts our health. As we know, as lifestyle medicine doctors, we're all about the diet, right? This whole food plant-based diet. But if folks are living in areas where like there's one grocery store, like the area that I practice medicine, there's literally up until a couple years ago, one grocery store within a several mile radius of where many of my patients lived. What are they going to do with that? In terms of like ability of like great fresh produce and, having all these other alternatives to the standard American diet. So these are some of the aspects to think about with the social determinants of health. And then if you go kind of upstream, you think about policies and you think about employment and all these other kind of larger societal forces that impact folks, politics even. This is a voting year. And so as a pediatrician, one thing we often talk about is like vote for kids. Use your vote to stand up for kids at the ballot. And this is something that I know as doctors, we think about a lot, but we don't necessarily like include that in our, anticipatory guidance that we give patients. Like make sure you like stand up for yourself at the ballot, like taxation, even with the census, thinking about the money that different communities get based on, their ability to get counted. So there's a lot of factors at play in terms of our individual health. And I think this moment in time is going to help expand our view that it's so much more than like, do you exercise? Do you eat right? Do you do your meditation? Like, what world do you exist in, and how easy or difficult is it for you to do all these wonderful things that we love to do ourselves and to encourage our patients to do?
Yeah, you hit the nail right on the head. It's not just about the individual. Sometimes we may say, okay, the individual is not healthy because they're making poor choices, but there's so
Exactly.
much more that goes into what choices a person makes. If you
Mm-hmm.
mentioned the grocery stores and having access to grocery stores or even like healthy restaurants, If you look
Yes,
at a lot of the minority neighborhoods, there's less
that's
parks,
true.
less
Yep.
places for open spaces, and they're
Mm-hmm.
more likely to have fast food restaurants as
Yep.
opposed to healthy restaurants. So what they see is, the fast food, and then also fast food is cheaper than going to a healthy restaurant. So if finances is an issue and whatnot, then you're going to gravitate to
Mm-hmm.
the food that's cheaper, especially if you're working two jobs. You don't have time
Absolutely.
to cook a meal, so you're just going to go to McDonald's and get the kids and you food from there. So there's a lot of different factors that go
There's
into
so
it.
many. There's so many. And then the other thing that just came to mind while you were talking was, the idea of, again, like the elephant in the room was like the racism and discrimination in the healthcare system. And that being like a major contributor to the differential health outcomes that we see as well. And there's a growing body of research to show that like we as doctors are not immune to racism and we're not immune to prejudice. And there were a couple of studies I was looking at that showed like even a majority of doctors in one study in particular had at least a mild to moderate preference for white patients after taking the implicit association test that folks can take on at the Harvard website. So it's important for us to kind of check our own biases as doctors, and especially non-Black doctors. Not that we can't have internalized racism, for sure we can, but it generally being more of a pervasive issue when you're treating patients who don't look like you, and how that impacts like your quality of care, even from things like, oh, how long you want to spend in the exam room with them, and how willing are you to treat their pain. And so there's like so many ways that this can play out where our bias as doctors can impact care and create health disparities too.
Yes, absolutely. And there's studies to show that persons of color are less likely to be taken seriously when
Yes.
they report pain.
Mm-hmm.
Physicians and healthcare providers seem to think that people of color have a higher pain tolerance.
Mm-hmm.
Whatever does that mean?
Yeah.
And you see it, in your day-to-day interactions at work,
Mm-hmm.
where, the person of color has a pain for whatever reason, whatever body part or whatnot. And
Mm-hmm.
people seem to be more likely to think that they're drug seeking than just
Right.
being honest.
Exactly.
And I can always tell what race the person is when they're talking about this patient to me, like it's before I've seen the patient. I can kind of always get a little idea.
Right.
And there's definitely differences in communication. And another issue with healthcare is a lack of trust because of what's been done to Black people in this country in
Absolutely.
previous health studies or whatnot, where they caused us harm. Let's
Yeah.
be quite frank.
Mm-hmm.
Yes, syphilis, somebody mentioned about that.
Yeah,
That's
the
exactly what I was
Tuskegee.
talking about.
Mm-hmm.
We
Yep.
don't trust going to the doctor, and we don't
Yep.
trust medication. I know so many times when I'm walking into a room, it's like a sigh of relief to my patient
Every
who
time.
is Black. If they see me, they're like, oh yes, somebody who looks like me. I can relate.
Exactly.
And it's just unfortunate because sometimes it's even like there's a difference in communication, right?
Mm-hmm.
Sometimes I work as a part of a team. So sometimes I perceive that the team thinks that the patient may be being difficult, quote unquote.
Mm-hmm.
And it's really just a miscommunication. And
Right.
I go in there and I can easily just smooth the whole thing out, kind of understand exactly where the patient's coming from. I'm like, they weren't upset. They weren't being aggressive. They were
like they
just,
were scared or
right.
overwhelmed
Yeah,
or any number of
exactly.
giving
Like
them
a
the benefit
normal
of the
human
doubt.
reaction. And
Yes,
so it's so important to have more Black doctors. Like only
it is.
5% of physicians in the US are Black. And it's so important because people are more likely to be able to trust someone that looks like them. So what I would say to anyone who has any medical problems and has to go and seek care in a medical institution, particularly if your doctor does not look like you, would be to, like you mentioned, to be an advocate for yourself.
Yes.
So
So
be confident in whatever it is you're coming in for, that it's important. Don't let someone dismiss you or dismiss your symptoms for whatever reason. If it's something that you've been having for some time, or it doesn't even matter, maybe if it was brief and the symptoms not going away, be an advocate for yourself and don't allow someone to dismiss you. If you don't understand what the instructions that's being explained to you, do not be afraid to ask. I find that sometimes minorities have, I don't know if it's a shyness, but they don't want to ask questions.
Yeah, and I think
They're
it's like,
not as assertive. I find that and I hate to use the term black and white, but I find that my Caucasian patients, even if they don't have a high level of education, even if they have like not even a high school degree, they seem to be more confident to challenge me and to ask questions or to admit that they don't know something. Whereas I find that Black patients tend to not do that.
I see
Even
that.
when I push for them to ask questions, because I really need, it's
Sure,
really
you
important for them
understand?
to understand.
Right.
And it's no shame if the instructions that I explained were not clear to you, because that means that I didn't do my job properly. That's how I see it as a physician. I feel like it's my job to break it down simple enough
make sure
so
it's
that the
crystal clear.
person can understand this. So that would be my second thing. Do not be afraid to ask questions and write things down. Before you go to the doctor's office, you need to have a list of all your medications with you,
absolutely,
so that you know what you're taking and know a little bit about, you know, your medical condition and your health, because it'll enable you to have a better conversation with your doctor.
I agree. I think those are really good points. And like, be persistent. I was just reading on one of our Facebook groups of Black female physicians about just like a string of kind of tough situations a few patients had gotten into, all revolving from not being listened to when they went to seek care. And so like getting turned away, being told that they didn't have issues, and then all of them having not great outcomes as a result. So I would just say, like, be persistent. Like, if you're not getting the care or response that you think that you deserve or need, go back or go see somebody else. Because again, like what you're describing and kind of like that response that folks often get from the healthcare system as people of color, that could be bias at play. And we know that. And so like another way to kind of counteract it is just be persistent.
Yes, absolutely. Let me look at some of the questions. Can you see the questions on your screen?
Let's see here. I can see some.
Yeah. This last question is interesting.
Oh,
Are you both taken equally as seriously within your profession, or does racial bias exist on that level as well?
that's a good question. And that's one of those where like, it's hard to know. Like, one would hope that one is being taken seriously as a medical professional who spent many years in school and, you know, postgraduate training. But what we know from the research is that as women and also as Black women, oftentimes there is like a lot of workplace prejudice, even if it's subtle. So it might be a situation where we're not necessarily aware of it, but we know from the research that for sure, you know, there's bias at play for sure.
I'm just looking at some of the other comments.
Yeah. One other thing.
Yeah, I do know that I feel that I have to prove myself, so to speak. And I don't know if that's being Black or looking young, but I do feel that in medicine, I feel that I have no room for error. You cannot misspeak, you cannot make a mistake, because you're not given the benefit of the doubt. Right. Whereas someone that doesn't look like me may be given the benefit of the doubt for, you know, a trivial mistake, like, you know, nothing that harms a patient, but, you know, just a regular, simple something. We're just not, I just don't expect to be given the benefit of the doubt. So I feel like my colleagues will more likely assume something negative about me if I did anything that they perceived wasn't correct. So there's always that in the back of my head.
Yeah, I agree. And I feel like that might show up for me as like, you know, a little bit of imposter syndrome. Like you have this like image of like the old white man doctor is like the head of the table. And then you come in and kind of subvert that in almost every way. You do kind of feel like, do I belong here? And then you have to kind of actively check yourself. Yes, I do belong here. I've worked really hard, and, you know, I know my stuff. I do belong in this room. I do belong in this space, and I do add value. But yeah, like, and I think that that kind of gets to that whole internalized racism. When we think about like the different levels that racism can play out, it's not always, you know, being the recipient of slurs or some
Mm-hmm.
overt, you know, racist situation. We can take these messages in, and it can kind of mess with how you look at yourself. And that's something that I'm really concerned with as a pediatrician when we think about how, you know, kids experience racism and discrimination early on, and how that kind of follows them throughout their entire lives. And that probably plays a role when you talked about how, like, we find like some of our patients of color or Black patients are more, you know, mild mannered, or like maybe a little bit more reticent to speak up. Some of that could be, you know, oh, are they going to look at me like I'm less than, like I'm
Right.
uneducated, that, you know, I don't know my stuff if I speak up to say, I don't get it, or could you explain it to me again? And so there's just so many levels at play here. But it really does start in childhood with like what our kids are exposed to. And, you know, they might not be like the direct recipient at young ages to racism,
Mm-hmm.
but they certainly see it play out amongst like their parents and communities and all that.
Yeah,
So
and they may not always be able to articulate it.
exactly. Like, yeah, you're exactly right.
Did you
It's
see that it was an experiment a couple years ago? I don't know when it was. It was
mhm.
with little children.
Yeah, like the
Um,
doll.
yeah, the dolls.
Yes,
And they
yes,
asked them which doll do they think is prettier, or
yeah.
which doll do they think is smarter? And
Mm-hmm.
overwhelmingly, all of them thought that the white doll was prettier and smarter.
It breaks my
So
heart
it's
every
like
single
even from
time.
young,
Mm-hmm.
this belief, or I don't know, I call it a delusion. I don't even know where it started. This delusion that
Mm-hmm.
lighter skin is superior. It seems to
Exactly.
be across all countries, all
Mm-hmm.
generations, and it's so persistent. And I don't
It's
know where it came
persistent.
from, or how we can change that.
I think that a lot of people are asking that question, like, what do? We recognize this is a thing and it's terrible and it's impacting a lot of people, and not just Black people. White folks are affected by racism too, because again, you think about like, you know, white supremacy and, you know, with even health disparities, everybody suffers when the least of us have bad outcomes, right? So like as we improve health outcomes for everybody, everybody's life expectancy will improve because our policies will be better, our neighborhoods will be better, our access to those elements that ensure we're healthy will be, you know, more widely available for everybody. So everybody stands to win as we deal with this problem. But I would say one of the first things to do is just acknowledge that racism is a thing. And I think that like most folks are at the place where they're ready to do that.
Mm-hmm.
Even if they like up until this point have been like, oh, I don't know how big of a deal it is in this current moment. I know that like slavery was a thing and, you know, Jim
Mm-hmm.
Crow was a thing, but right now we had a Black president. Racism isn't that big of a deal. But I think the George Floyd incident sadly has brought to mind that like it's something that we need to address head on. And one thing I would say as a pediatrician is just like acknowledge that race and racial differences exist. Not racial differences in the sense that like, you know, of stereotypes, but more so there are different skin tones and there's this like social construct called
Mm-hmm.
race. Obviously, we don't want to say social construct to kids, but let them know that there are these like divisions in society based on where you're from called races. And that doesn't mean one is better or worse than the other, but that these are the designations. And then from there, moving on to talk about this beast called racism, and to start those conversations sooner than later. Because I think up until this point, a lot of non-white households have shied away from it. Like racism is a dirty word
Yeah.
that we don't want to say. But I don't think that we can do that anymore, because that's the only way that we can start to change the hearts of folks
Mm-hmm.
early on, is by talking about how hard it is and like how it affects people, and kind of taking it from there. But I think acknowledging
Yeah.
is the first place.
That's like first step.
Yeah.
And rather
Thank you.
than being defensive, sometimes people can be defensive and say, "Oh,
Yeah.
I'm not racist." like, forget the labels, okay?
Right. Forget the
If
labels.
you are a human on this earth, particularly if you live in America, you are conditioned to believe that
Mm-hmm.
lighter skin is better. That's
Yes.
just a fact.
Mm-hmm.
Even people of color are conditioned to believe that lighter skinned people are
Right.
better. Even
Mm-hmm.
me and my skin color, people, it's pervasive. You know, myself
Mm-hmm.
compared to like darker skin people have different experiences
Mm-hmm.
based on the color
Mm-hmm.
of the skin. So it's just pervasive. So,
Very.
like you say, acknowledging it is the first step,
Mm-hmm.
and listening. You know,
Yes.
I just wish that more people
Mm-hmm.
would listen instead of jumping to judgment and
I agree.
jumping to dismiss what someone else is saying. Like, if
Yes.
you, just because you don't have a particular experience
Mm-hmm.
doesn't give you permission to discredit someone else's
You
experience.
got that. Say it again. That is so
Like,
important.
you don't have that right.
Yes.
So
Yeah.
listening is the first step. And
Mm-hmm.
like I said, I think I have an interesting view of the situation because I didn't grow up in this country.
Right.
And to be quite honest, the perception that the media
Mm-hmm.
gives of the world of Black people is negative. It's very
Yeah.
negative. And so if you don't interact with people that are of color, then
You have
that's the
nothing to
perception that
counteract
you would
that.
have.
Right.
So for me, honestly, it wasn't until medical school that I really
Mm.
interacted with um,
Like Black
African
American.
Americans.
Oh,
I
interesting.
considered myself Caribbean. I actually
Right.
really wasn't aware of my Blackness
Mm-hmm.
until I came here, because they make you
Mm-hmm.
so aware that you are Black. Like, I thought
Yes.
of myself as a Bermudian. That's how I thought of myself. So it was
Right.
just a weird shift.
Yeah.
And
That's
then
interesting.
I'm just being transparent. Like, when I first came here, and I would hear people talk about racism, and they would get angry and upset, and I used to be
Mm-hmm.
like, "What are you talking about? Like, we're not in slavery right now." And I'm embarrassed to kind of say that now, but that's how I felt. So I can kind of
Different
see
time.
how white people think
Mm-hmm.
this, because
Yes.
I kind of used to think the same way until I
Mm-hmm.
started to meet people
Yeah.
that grew up in this country and that would share their stories. And then I
Mm-hmm.
started to experience it. And I was like, wait, I'm being treated
Mm-hmm.
differently here than I am
Yeah.
at home. At home, you know, respect 100%. Like, oh, she's
Mm-hmm.
smart, she's intelligent. They give me the benefit of the doubt. I don't
Yeah.
have this cloud that's hanging over me where I feel I have to prove my competency.
Mm-hmm.
They assume that I'm intelligent at home, whereas
Mm-hmm.
here I feel like it's different.
Working
So
uphill.
yeah.
Mm-hmm.
So
Mm-hmm.
that's definitely been interesting. So just listening,
I think that's
like,
so key. That's so key. And again, like you said, like not to invalidate someone else's experience just because it's different than your own. That's so important. And one thing that came to mind when you were talking about getting to know people who have a different lived experience than your own, for kids, that can be kind of hard, right? Like we have our neighborhood set up. And while there can be some actions taken proactively to ensure that your family is interacting with folks who don't all look like you or have the same socioeconomic background than you, such as like sports activities and things like that. One other way that families can do that is through reading. And I would challenge every parent on this IG Live to like look at your children's bookshelf and see what color are the characters represented there. And if they all kind of look like your kids, then that's a beautiful opportunity to, open up the world to your kids in a very non-threatening, easy way to folks who look differently and like their life experiences. And it doesn't always have to be about the civil rights movement either. That's one trap that I feel like books about Black kids fall into, where like everything's about Martin Luther King or Rosa Parks. We can just have happy Black kids living their
right.
lives and going about their business just like all the other children's books out there. So I think that can be another avenue.
Yeah, that's a good idea, to read books,
Yes,
because the media is going to be limited in the view that they're presenting.
very.
So books are key.
Mm-hmm. Definitely, definitely. We have some questions.
Yeah, let me see. This is a good question. What steps can be taken to bridge the gap from a grassroots level and a policy level?
Mm-hmm. Mm-hmm.
I know
That's
on
a.
a basic level,
Mhm.
voting.
Yes, I was going to say that.
Not just
Voting
every 4 years,
conversation.
but in your county, in your city, locally, make sure you're participating in the voting that takes place for the judges, the district attorneys,
Mhm.
being active in your local county is important.
That's very important. And then the census, I'll put another plug in
Yeah.
for the census in terms of like tax dollars and how that can really, create different
Mhm.
neighborhoods based on the money that they have coming in. So I would say that's another great way to, um, to start off with.
Let me see. And then also in our own circles,
Mm-hmm.
being brave enough to have conversations that are uncomfortable.
Yes.
And saying it in kindness. I think you can win people
Mm-hmm.
more over with kindness, although I know it's hard when you're hurt and you're angry, but I think it will be more effective in some cases, um, to see each other's viewpoint and
Mm-hmm.
sort of have an open conversation about race and racism.
Right.
Um, and so let's see what other questions.
And while you're looking at questions, like just thinking, going back to the implicit association
Mm-hmm.
test, like I like that. So basically, for those who don't know, Harvard hosts this host of different surveys that you can take that look at your level of implicit bias as it relates to different subsets of the world. So even thinking about gender, colors, like colorism, you were talking about race, and even I think sexual orientation. So they have a host of different subgroups that you can take an implicit association test to see what your internal level of bias is. And that can just be like a very heartening and eye-opening experience for folks who are just new to exploring these issues, just to assess where am I starting from. And that can often, I think, lead to some humility too when approaching these tough conversations that, wow, I have some work to do.
Mm-hmm.
And the tests are very like unassuming, non-threatening, but they're a great personal way to take your own pulse, if you will,
Mm-hmm.
as people embark on these difficult conversations.
Yeah, and it's important. And these are not bad people. That's what I want to
No.
emphasize. I think sometimes people, like I mentioned, say, "Oh, I'm not racist."
Yeah.
You're not bad people.
Mm-hmm.
It's just that this is what society has conditioned people to believe,
Everybody then. Mm-hmm.
everybody to
Yep.
believe. So just taking an honest reflection of yourself and where you are, what's
Yes.
your perception of people of color,
Mm-hmm.
and making a conscious effort to try and change that. And one
Yes.
way to change that is to change the narrative,
Mm-hmm.
like reading books, reading about educated Black people, reading about Black people that have made many contributions to society. There's numerous stories of such. So
Mm-hmm.
that's kind of a start there.
Yeah.
Um, there's one question that says, what's the best way to address your doctor if you feel they are not listening to your issues like chronic pain?
Mm-hmm.
I would say if you feel like your doctor is not listening in general, like if they're not empathetic,
Mm-hmm.
then maybe it may be time to see another doctor.
Mm-hmm.
Um, if this is repeated visits and you feel like they're
Yeah,
not
I agree.
listening, I think probably at that point it will be time to see another doctor,
Mm-hmm.
because there
That's not
may
going to
be
set you up for.
some, yeah, there may be some bias that they have about chronic pain. I know
Mm-hmm.
um, some people do have biases about that, but that's
Yeah.
what I would say. Um,
And
and then,
I was just going to say, even, I know that issues like chronic pain are challenging and multifactorial. And the way the healthcare system is set up,
mhm,
where we have such short visits. So I would say, like, have a designated visit just about the pain, where it's not being kind of squeezed in at an annual visit or some other time where there are 1,000 other things being talked about, because I know that can be really hard in primary care. But like you said, if after doing those things, you're not getting the response that you need, there are many other doctors out there.
yeah, that's a good point. And someone says, is there any financial assistance in place for people who can't afford American health care?
There are. So we do have the public health insurance system in term called Medicaid. And then and I know that has been expanded in light of recent hardships, I believe, and also thinking about like the health exchanges. So Medicaid is historically, though, our big safety net, which doesn't cover everybody who needs it, needs health insurance, unfortunately, but that's historically what we use.
Mm-hmm. Mm-hmm. And if you look in your area, like you can actually just do a Google search of free clinics.
Yes.
In my area, there are several clinics that see patients that don't have insurance. Some of them have a sliding scale based on your salary, but it's pretty reasonable. And there's also a pharmacy resource if you don't have insurance and you need medications. It's called GoodRx.
Yes.
It's an app that you can look up drugs and see which pharmacy has the lowest price for it. And then sometimes they also have discount coupons for different medications. So
it's a good resource. GoodRx, I love that one.
Yes. And then so also I want to comment on lifestyle medicine and plant-based nutrition too. And the importance of that and how that can give people that are otherwise marginalized by society, it can give them some sense of power or freedom over their lives. Oftentimes people think that genetics is the most important factor in whether you get a chronic disease or not. And I deal with diabetes, hypertension, heart disease, and things like that, on a regular basis. And food really has the power to improve our overall health status. And I've had patients that have been able to take less medications by going towards a more whole food, plant-based diet. And so although it may be challenging for different communities, people of different financial backgrounds, it's not impossible. And actually, if you look at culture, I often hear, I'm in North Carolina, so sometimes people say, well, the Southern culture is not plant-based, or that's not my culture. But if you look at what people eat in Africa, it's, I don't see, okay, there you go. It's majority plant-based. They do eat meat, but it's not meat heavy, it's not fried and processed food, it's mostly plant. So if you want to go back to, if you're a person of color and you want to eat what your ancestors ate.
Right, going back to the roots.
Yeah, you want to go back to your roots, you got to eat more plants. And so that's my stance. What do you think?
I agree with everything you just said. Our diet is our main tool here. Ending racism and systemic discrimination is a long game. It is vitally important that we get this right. However, that's not going to be fixed tomorrow, unfortunately. What we can fix right now, or at least significantly improve, it's our diet. And of all of the tools in our lifestyle medicine arsenal, our diet is the most potent one in terms of really moving back to that whole food, plant-based diet. And just knowing that it doesn't have to be an all or nothing thing for folks who are just getting started. You don't have to be a vegan necessarily, but significantly reducing your consumption of animal-based products can do wonders in terms of reducing your risk of all the chronic diseases that are the big killers of Black and white Americans both. And so, just baby steps towards that healthy plate that we always talk about, where it's half fruits and vegetables and a quarter whole grains and a quarter healthy protein. And in this case, the beans and legumes and the tofus as our healthy proteins of choice. But I agree with you. It's not impossible. It definitely takes some planning and a big mindset shift. But I would say of all the things that we can do right here, right now, as Black people and as people of color who are experiencing the brunt of health disparities, it's tweaking our diet to this whole food, plant-based way of eating. I wholeheartedly agree. From a personal note, I've experienced it, and professionally, I'm recently starting to get into advocating for it amongst my patient panel. But I've interestingly, like I serve a predominantly Medicaid eligible population in my clinic, and I've had actually like dozens of patients come in who are interested in plant-based eating, and they've heard like X,
Awesome.
Y, and Z celebrity who's gotten into it, or their auntie started doing
Mhm.
plant-based, and they're like, Dr. Huff, tell me about being plant-based. And so I love these conversations because they're so ripe for the information, and like I've definitely seen like small moves in the right direction in terms of like weight gain being stabilized, and you know, slow improvements in A1C for kids who are
Mhm.
pre-diabetic. So we definitely see results pretty soon. But I agree. This is what we have in our palms right now.
Yeah. What we have on our plate and our fork.
You
And,
got it.
you know, like you say, healthcare disparities will take some time to, you
Mm-hmm.
know, improve and change. But if we know that a system is biased,
Yeah,
our best interest would be to try and minimize our contact with the system. That's how
you
I do
got
it.
it.
Make
Mhm.
yourself healthy enough so you don't have to be in the doctor's office all the time or in and out of the hospital.
Right.
So that's kind of what I like to give my patients, my clients, you know, tools so that they can be healthy, so that they don't need to come and see me in the
Mhm.
hospital. Really.
That's the goal. That's the goal, to move from the sick care to the health care,
Yes. Yeah.
with the power of our lifestyle. I agree. I definitely agree.
Yeah. Well, this was awesome. I really enjoyed this conversation. I feel like we
Me
could
too.
talk like for a long, long time,
I
but
know, like there's so much
I
more to
think
talk
it's,
about.
yeah, I think it's like been 45, 50 minutes. We
Okay.
definitely have to do this again.
We should do a part
Um,
two for sure.
yes.
I
Let me
love
see
this.
if there's any other questions here that I didn't see.
All right.
Lots of good questions and comments. How do you navigate these conversations about food and other lifestyle medicine topics with your patients with
Mm-hmm.
lower access and resources?
Mm-hmm. That's a really good question, and I feel like
Mhm.
it's very germane to our conversation. But I would say one of the big, I think, mis thoughts about whole food plant-based eating is that it has to be expensive. And while there are a lot of like these
Mhm.
high-end products that do cost an arm and a leg, I just went to the grocery store this weekend and it was an arm and a leg.
Yeah.
However, it doesn't need to be that way. It can be as simple as your $2 bag of brown rice. It can be as simple as
Right?
your 99-cent bag of dried black beans. And you can make a beautiful meal with like a couple of avocados and like a few herbs. So
Mhm.
it doesn't have to be expensive, but it does take a change in your mindset in terms of, this is food that I consider to be like an entree versus like a side dish at a cookout, because usually beans aren't like the main event.
Right.
But beans are my main event when we eat at home. That's a great meal. So I think that it can be done for sure, but it just requires like a shift in terms of like what good food is and what satisfying food is, which is a whole nother conversation that, you know, getting into culinary medicine and making sure things taste great and all that.
Right. Yeah, that is so true. I love that. It's shifting one's mindset.
Yeah.
And then also shifting one's mindset about disease, because
Yes.
oftentimes if you're in a family where everyone in your family had diabetes
Mm.
and heart disease, you tend to expect that to happen to you. You
Yes.
accept that as your
So
narrative,
true.
and it does not
Mm-hmm.
have to
Mm-hmm.
be that way. So changing your mindset about disease and also
Yeah.
changing your mindset about food.
Mm-hmm.
And a lot of the healthiest foods are not that expensive, like you
They're not.
mentioned, beans, potatoes, apples,
Mm-hmm.
oranges. Stay
Yeah.
away from the processed veggie meats and the fake cheeses,
Okay.
because those are expensive. But if you
Mm-hmm.
just stick to the basics, you're good.
Great meal on the
Yeah.
low. Hmm. Changing your mindset about disease, that's a very powerful thought. Like that is so key. And it's interesting, I see that in pediatrics a lot too, where like I'll have kids who are pre-diabetic and the mom's like, well, yeah, everybody, the aunt, the grandma, the dad, the this, everybody in the family's got it. So it's kind of like, and I'm
Mhm.
like, it doesn't have to be. Let's talk about the
Right.
things that we can do. But you're so right. Like there's such a there's such a misconception in terms of what diseases running in families really means, and that
Mhm.
a lot of times it's really not genetic, but it's more so those kind of, you know, intergenerational ways of living and being and cooking and you know, existing that set us up for getting these different diseases. And so there's just so much to unpack in terms of health disparities and culture and family dynamics and, you know, discrimination. There's so many levels
Yes,
here.
so much. It's levels to it.
There's so many levels to it.
Yes. All right. Thank you so much, Qadira, for coming on.
My
And we
pleasure.
definitely need to do this again. This is going to be saved on my page, and then I'll figure out a way to send you the video so that you can post it if you want.
I would love that.
And someone asked where we're both located. I'm in Raleigh, North Carolina. My page is at the Plant-Based MD, and my business is New Out Health. But if you go to my page, it has a link to it, and let them know where you are and where they can find you.
Perfect. So I'm in Washington, D.C., and I am at Qadira Huff MD on Instagram. And like Dr. Judy, you can link to my business, Sprouting Wellness, through my page.
Awesome.
Thank you for having me on tonight.
Thank you. All right, everyone. Thank you so much for joining. Have a great evening.
Good night.
Bye.
Bye-bye.